Hello, I'm Admiral Rachel Levine, and we're here talking about food is medicine. Now, I'm here today with Dr. Melanie Hingle, professor at the University of Arizona's School of Nutritional Science and Wellness. Dr. Hingle, thank you for joining me today.
Thank you for having me. As a nutrition scientist and public health professional and dietitian, I feel like it's really important to apply that combination of things to address the dual issue of food insecurity and diet-sensitive disease, including diabetes. And I do this by working in partnership with community organizations who serve vulnerable populations, people who are among the highest risk.
Right. We have that duality in the United States and in the Western world in general of food and nutrition insecurity, yet those diet-sensitive diseases, as you said, of obesity and type 2 diabetes. So what kind of behavioral techniques do you do to try to address that duality?
Yeah, one of the main things we do is help people gain access. So that's not so much of a behavior as addressing a social determinant of health, right?
That's exactly right.
Super important. And for people, it's not that they don't want to eat healthy, it's they often don't have the resources or the ability to access that healthy food. I work, again, with a federally qualified health center in Tucson and a food bank, and we're in partnership helping the clients and the patients of those organizations gain access to food through actual food delivery in the medical home. So we give them medically tailored groceries that fit their diagnoses, and we connect them with a registered dietitian, nutritionist, and with community health workers to get the education part to supplement that food. And we're testing a very practical question, and that is just providing people with that basic need enough to help them manage their diabetes.
Right. Any preliminary results?
Well, so far we know that it's helped people certainly manage their blood glucose a little bit better from anecdotally. We're going to be doing the measurements and finding out for sure toward the end of this year. We know the education part is very well received, and we know it helps people gain access to other important appointments at their medical home, which is really critical.
Produced by the U.S. Department of Health and Human Services.